Hi everyone. So we'll wait for people to join.
Okay.
Yes, we're
Can you
on.
hear me great?
We made it, doctor. We
I know
made
I
it.
told you I am not a social media kind of a guy.
بس خلاص, after this you will be like a
No
pro.
issue, no issue. Hi,
How are you, Dr.
I'm doing
Ahmed?
great. How you been?
Good, good. I'm due for a session. I'm coming soon.
Okay, yalla. Every session.
Doctor, I first of all, I really wanted to thank you for making the time. I know you have a busy schedule. And I really wanted to have you here because you really kind of transformed my back and my spine. So I wanted people to benefit from your knowledge and your advice and treatments. And so I want you to first start with introducing yourself.
My name is Dr. Ahmed Dessouki. I'm Canadian Lebanese chiropractor. Been in UAE for the last 18 years. It's been a long time. I've always had my own practice. I came to the EU and started my own chiropractic practice. I've been practicing for the last 22 years now. I did 6 years in Canada, and the rest, actually, about, yeah, something like that. And the rest is in the UAE practicing. Um, I've seen thousands of people, great people. We've had so many success stories, as you know yourself too. And
Yeah.
a variety um, conditions, starting from babies, pregnant women, car accidents. Yeah, it's been very yeah.
Interesting. Interesting journey for you, Dr. Ahmed. Seeing everything, huh?
Yes.
I have to say, if you are in Abu Dhabi and you don't know Dr. Ahmed, you don't know Abu Dhabi. Like, I feel like by now you've kind of fixed it. Almost everyone I know in the city, yani, mashallah. So I really wanted to talk to you about, my case. When I came to see you, I've been going through chiropractor treatments on an ongoing basis, but due to the pandemic, I kind of stopped going and stopped treating my back. As you know, with the C3 and 4 and the pressure on the shoulders and everything, and I had the vertigo. Tell my viewers, how was my condition? Because a lot of people underestimate what really happened during the start of the pandemic.
You see what happened with the COVID. Lots of people just stopped doing everything. Just stopped moving. Okay, so they sat home, sat on a computer for a long time, bad posture, bad even eating habit, no exercise for sure. So when you sit that long and in a bad position, you really load too much tension on your shoulders and on your neck, as well as on your lower back. But in your case, it was most of it in the neck. So that the muscles, because if your head is forward, your muscles always working to hold your head back. So it becomes very tight, even with the area, the suboccipital area within your case. That's what caused the restriction of blood flow onto the brain. So the vertigo, it could be caused by ears or the neck. In your case, was the neck. And working your muscle was so, I mean, and that's what everybody's now, because working on a laptop most of the time, or on a phone or an iPad. So the head is down a lot.
Yeah.
And so these muscles overworked, okay? And you don't exercise, not enough blood flow, and most people don't drink enough water, and so you get dehydrated. Everything just kind of builds up and become tight, and start to press on the nerve, on the spine, and you interfere with the nerve functions. When you interfere with the nerve function, that just your body is gonna get sick. It's not gonna function proper. So the communication between the brain and the body is actually, it's kind of it's interfered by or blocked due to the blocking in the vertebrae. So when we deal with the chiropractor, what we look for, it's called a misalignment or a blockage in the vertebrae. The vertebrae is not moving proper. Could be fixation would cause cause interference of the muscle. So the messages from the brain to the body is not going proper. It's like a computer, you know. So if the wire is not connected proper to the main motherboard, it's not your computer is not going to work. Same thing with the body, okay? And that will affect even not just your muscles, it will affect your organs, every place that the nerve supplies, and affect the blood flow that goes with that nerve to the areas. Okay, in your case was the suboccipital area. So when we worked on the muscle and we did the adjustment, even with the C1, that I just see infused treatment, and the dizziness and the vertigo were gone.
Yeah. I was quite impressed. I remember when I first was like feeling the spinning feeling and dizzy and can't be in like a place where too much light. I could not believe that I don't have an ear infection. But then when I figured out that my neck and my shoulders was under a lot of pressure from not having the right setup at home to work, and just working hard, and as you mentioned, like limitation of exercise, and all of these things really, really hurt me. And I remember coming to you with almost opening one eye only because I could not really function properly. And it's really, I feel a lot of people neglect their spine in general, especially young people, and especially young executives, entrepreneurs. And I know from our past conversations that lately you've been seeing a lot of young people coming with issues.
Yeah, again, as you see, I mean, the body has incredible way of healing itself. So you don't need medication or anything. You just have to make sure the spine is working proper, the brain is working proper, your body will heal. I mean,
yeah,
it's just incredible. Okay. Now, the big issues now with the young generation is they're sitting with the iPhones in their hand 24/7 almost. It's not just iPhone. I mean, everything they do is with their head being down. Okay. So the spine is going forward. They're losing the curvature in the neck. And that should happen later on when they're 30. Above that, you start having straight spine in the neck. When you have straight spine in the neck, I see that with lots of teenagers. I mean, you ask now any teenager to try to touch their toes. They can't because they're becoming so tight from sitting. That muscle is shortened. Their knees always, so the quad is tight, and the muscle, the hamstring is actually became short. So now they're going to have back pain. Sure, I had 8-year-old girl. She had back pain. So we checked her hamstring. She couldn't even go more than 30 degrees forward. So that's just,
oh, wow.
I know. So now, I mean, sitting for a long time, bad posture sitting. So you're leaning forward. You're losing the curvature in the lumbar spine, as well as in the neck, which causes lots of stress on the discs and on the joints. So imagine these guys when they hit 20 and 30, they're going to be in big trouble. It's technology that we have in the wrong positions. So we need to make sure that the iPhone is high, at least raise it up to with your head being back a little bit, looking forward, and having always something behind their back, because the lower back, lumbar spine has to be curved in. So when you're sitting, it has to have a little bit of a curve, like a curve inside, not back. So if you look now at anybody, especially with whoever sits long, they're slouching, and that's what we call it. Shoulder forward, head back, and the back is become reversed backwards.
Yeah, I think it's so critical because also people have such a misunderstanding about chiropractor treatments. They think like chiropractor is for people who've had car accidents and everything. There's so much to it, and they only think that people in certain age range can actually go and have chiropractor. What do you think about that?
For sure. I mean, we treat from infant all the way till seniors. We treat so many different conditions. Okay, like in Canada, we had a family practice. We called it family practice. The whole family comes in, mother, father, and kids. We treat we treat scoliosis. We treat crazy stuff now, like with the bedwetting, colic kids. Like infants, we start with the colic with the infants, right? And we go on growing pain with sports injuries. Lots of young people, they have sports injury, and then even we could adjust the ankles and the knee, and that helps to heal the joints quicker, right? So we could heal. We could try to treat everybody. Now, for sure. I mean, the success rate of chiropractic treatment is 80% success rate. Okay, 80% of the people will get better. 10% of the people might get better, and might not get better, and then 10% of the people might not help. So the percentage is incredible. Okay, and we're not interfering with the body. We're not putting anything inside the body. Now, we're not against necessary drugs or necessary surgery, but again, you could have other options. Like we've seen patients with severe bulged or protruded disc. They would be booked for surgery, then they come to chiropractic, plus, I think, which is essential also in doing sports, like doing proper exercise with chiropractic care. Your body should be healthy. You know, you shouldn't be with kids. They wouldn't be sick too much. Like my boys, when they were young, we would adjust them all the time. They never got sick. They never took antibiotics.
I actually had a friend of mine who had her newborn, and she was telling me, I'm going to the chiropractor. This was my first experience learning about the fact that chiropractor treatment can work for newborns. And I was like, why are you doing that? And she said, because, you know, I need to make sure the muscles and everything is unlocked and everything. And it was such an eye-opener because I honestly didn't know. And I know that you've also talked to me before about some women who are pregnant and they needed like just support because they suffer from a lot of back pain.
Even more than that, actually, there's a technique. It's called Webster's technique. Webster technique that helps with the babies, with the baby sitting, and after the month 6 or 7, we could. The adjustment is actually very gentle. There's so many different techniques of chiropractic. People think chiropractic is only cracking the spine. There's about 20, 30 different techniques to do the same thing. We could use a small device, it's called an activator, to adjust babies. With women with pregnancy, we have a special actually like pillow with the hole in it, so the stomach goes in there, and you treat the sacrum. Plus, you release the round ligament in the uterus, which 96% of the time the baby turns without touching the stomach.
Oh wow, that's amazing.
It's incredible. And you know, again, the activator technique or the Trox technique, it doesn't take, you don't use force when you do the adjustment, okay? And you don't hear the cracks, but it does stimulate the nerves, which will allow the body to relax, because the sacrum is a sympathetic reflex to the uterus. It's a muscle. The uterus is a muscle. So when what happens is when it's tight, you stimulate the second sacrum, okay? That sends message to the uterus, it will relax automatically, and the baby has room to turn.
Yeah. So Dr. Ahmed, yani, you think that, for example, in my case, it's a special case because I had problems and I had a lot of issues with my back due to car accident, and then, you know, all the things that I had to go through. But what do you recommend people see chiropractor? How often?
Well, it depends about the case. Well, best say case scenario, what we call it maintenance, once every 4 weeks to 6 weeks. Research shows that if you have an issue like misalignment for more than 21 days, your body could change. The change will be on the cellular level. So the cells start to get damaged. Okay, it's because it's like a silent inflammation and silent misalignment that you don't feel pain, but you know there's something going on. So 4 weeks is a good time, up to 6 weeks. Okay. People need more independence. You see, talking about car accident, actually, I gotta talk about this. It's car accident is one of the dangerous injuries that you would ever get, because what happened is when you have a whiplash, you're not gonna have any break in your bone. So when they do the X-ray that they start with, they do, okay, you're normal, go home. Okay, it's not true. You get all the muscles around the neck, even your jaw gets messed up. Actually, gets overstretched, and when it heals, okay, it will not come back to 100%. You'll always have like a damage in these muscles, and they're not flexible. If you're lucky, you get 70% back of the flexibility. So now what happened? 10 years after the car accident, and I find that amazing. Like on the X-rays, we see it right away. Most people will have reverse neck and reverse curve in the neck, okay? And they start the disc degenerating. So when we ask that question, have you had a car accident? Oh, nothing major. I was hit from behind. The other car was going 100. If you get hit from behind with somebody going more than 20 kilometers, you messed up your neck. And that shows up
Yeah.
big time. I mean, then people will say, well, I had no issues, no pain, and all of a sudden I felt pain in my neck and going down my arm. They told me I have a disc. Yeah. In these years that your body was just compensating.
Yeah. Totally, I agree with you 100% because this is exactly how my issue started. In 2010, I had a very bad car accident. X-rays, MRI shows that I haven't broken anything. Alhamdulillah, I was in a good shape, but I wasn't in a good
Exactly.
shape because all these issues started coming up afterwards, and I was like, "What's going on? Why I'm so tense? Why I'm so like even anxiety, Dr. Ahmed, even anxiety levels were going high because I was so tense and MRIs and X-rays, nothing showed except that I have slight movement, C4, C.
Yeah, you give you muscle relaxant anti-inflammatories, and you're just postponing the issues. Like in North America, especially in car accident, you get treated up to 1 year. Physiotherapy. Wow. And after that, what happened actually, the funny thing is, the interesting thing is the insurance company in North America, they do a settlement. Like people get money out of it, right? So they do a settlement and they make you sign a waiver that you will not sue them in the future if any complication happen. Because they know that will happen. It will cause you pain in the future.
Yeah. It's interesting to learn all of this. I actually have some of the people here commenting. Someone is saying, oh my God, I feel he is literally talking about me. Demo case is right here. And then I have one of my team members, Khidr, who's I'm going to bring, by the way, I'm going to bring him to you because he desperately needs some adjustments. And I have a good friend of mine, Fatma Al-Madani. She was like, she's commenting and saying, one of the best doctors I visited when I lived in Abu Dhabi.
Oh, okay. With
a happy face. So a lot of people.
I'm an old guy. See the white.
So Dr. Ahmed, I have to say that when I spoke to a couple of people, like my friends and stuff like that, especially entrepreneurs and executives, because I was telling them that you don't understand how important it is for me to schedule my chiropractor session, my physiotherapy, cupping, dry needling. This is all like part of a program for me. And I was saying to them that when I miss a session, I can immediately see it because I'm always tense and I always see it. So, but I feel like a lot of entrepreneurs, they work so hard, you know, they're on the go, but they don't watch their back. They don't watch the spine. And then they suffer. And then they call me, Kauthar, I need help. And I remember I've sent some people your way because I don't know how we can create awareness beyond, like, why do people have to feel the pain to look after their back?
This is the
what can we
now
do?
with people working in offices, entrepreneurs and people that they successful in their business, they work hard. They spend too much time sitting in an office. Okay, a study came out of the UK. It shows that people that sit in an office, like have high risk of health issues more than a smoker. Okay, so back very bad, and you're tense. Your muscle becomes short. Your blood not going enough to the brain. Even the blood is not going to the muscle. You're gonna be tense. You're gonna be you'll have what we call tension here. You'll have like this tension here in the neck, in the face. You can't focus proper. An adjustment takes you from that. Your body is in what we call a sympathetic mode. It's always fight and flight. You're always going. You're always going crazy. Drinking coffee and tea. This is all stimulant, puts you in a sympathetic reflex, right? So when we adjust people, okay, that automatically brings in the parasympathetic response through the nerves, and the body relaxes. And that will actually makes you focus, makes you sleep better, okay? And a very interesting thing, an adjustment for the C1 increases the white blood cells by 45%. So increases your immunity. So by having the neck adjustment, it will focus better. It will help your body to actually deal with things better, even if you'll be sitting better, right? Again, exercise is essential.
I find it now that I've recovered from the vertigo situation and spinning, I kind of, it was a nightmare. And now that I'm back at working out and working out hard, doing tennis, strength training, swimming, and all of that, and boxing and kickboxing, I know, Dr. Ahmed, you're always proud. I mean, you told me last time I've lost weight, so I was very happy. So I think, you know, it's very important as well that you don't really need to have a problem to make sure that you can prevent injuries and issues or
For
long-term
sure.
issues with your back. Like Fatma just commented saying can I share that Dr. Ahmed explained to me the importance of exercise and strengthening the muscles on your back and on the neck to protect the spine. It stuck in my mind and I focus on it now. Alhamdulillah, my back pain disappeared. Haven't felt it in years. So this is like a proof from an existing client, and she's a good friend of mine. Yani, I didn't know you were a patient of Dr. Ahmed. Yani, we are a tribe. And she's an entrepreneur and a mom, and you know, she has lots of things
This
going
is the
on.
thing about a physician. I mean, we know 80% of back pain due to weak muscles. Okay, so what happened? You have back pain, you go to the normal, stream like work as you go to the doctor. They give you anti-inflammatory, muscle relaxant, and all these things, but you have to really work the extensor muscle. Most of people, like the extensor stabilizers muscles, are weak, and this is the big issue with chronic back pain. So I highly recommend Pilates. On one of my patients, I kept telling her, and she started Pilates. I didn't see her for years, and she came back one time just for a checkup. She said, "Guess what? I opened a Pilates studios."
Wow.
I mean, so again,
Wow.
that doesn't have to be a necessary Pilates. Any extensor workout to your back, swim is incredible for the back. If you could swim, this is amazing for the whole spine. Okay, so yeah, extensor muscles are being neglected. Posture muscles being neglected on the kids right now, and I highly recommend swimming, especially backstroke swimming, to make their small muscles strong, which help them to sit proper. Posture muscle is just going to sleep.
Dr. Ahmed, why do you think people are very skeptical about chiropractic?
There's, people that they don't know exactly what they say. They think a crack is we're cracking we're cracking the bones. We're not cracking anything. The noise that you hear is mainly gas release. Okay. Now there is I think medical doctors in medical profession don't know exactly what chiropractic does. Okay, I mean, we go through training like any normal doctor. Plus, we take extra X-rays courses plus the techniques. Okay, I think they don't know enough. They need to know better. Now there's lots of stuff on Instagram, and again, you don't have to make the huge noise, the crack in the neck that makes or the back that makes. There's other techniques that we could use. People that don't like to hear that noise, the sound. There's so many different things.
Yeah, I remember coming for a session, one time, and my mom was telling me, "How can you do this? Like this, the sound doesn't terrify you. Like this sounds painful." I was like, "Mom, it's not painful at all. It's just a noise, and it's such a good feeling. It's it's such a satisfying feeling afterwards because you feel like you're so relaxed and, I don't know, fixed."
You see, exactly. We don't use force. We use speed in the speed that you do when you do the adjustment. I mean, it takes we get trained, highly trained in school that, doing your working with people. You have this skill of being very quick when you do the adjustment. You don't have to use force. I mean, I get sometimes people like they're 150 to 100 kilos and I adjust them. And then people like, how can you do that? It's the speed that you use that will affect the nerve, okay? And again, I mean, I would recommend people just to don't go with the, just go watch movies and see people getting cracked and stuff. Read more about what chiropractic could do to the nervous system, the whole body. Like when I started chiropractic, I'm Lebanese originally. We had no idea about chiropractic. My personal experience, I used to have headaches and I used to sleep on my stomach all the time, which is very bad things, by the way. I have to note that. And I went to a chiropractic in Calgary, did the adjustment, and funny enough, actually, I'll tell you this funny story. When I learned English in Canada. I got there, left Lebanon, 88, went to Canada, learned English. I was asking the guys, like some of the Canadian people that were in our school, what are you going to do? And they said, I heard chiropractic. I thought it's a mechanic thing. Okay. Then one time, one girl was filling out a form for chiropractic school, and I'm like, what is this? She said chiropractor. I'm like, are you gonna be a mechanic? Then she explained it to me. I went and saw this chiropractor, did few adjustment on my neck. My headache was gone. My neck was so relieved.
Yeah.
And that was one of the reasons I went to chiropractic school. I was studying to become a dentist, actually.
Wow, wow, this is so inspiring, Dr. Ahmed. I have Rashida asking, one of my best fans, by the way. She's asking, I wonder if practicing yoga can help with back issues.
Great, but she needs yoga is amazing to flexibility wise and even for as an exercise. But I think she needs to get into more Pilates and swimming. Swimming is because it does the whole back. So most people have not only back issue, but will have also with it with the neck. So swimming will do the whole thing. Pilates is incredible. So she combines yoga, Pilates, in swimming. It's like incredible stuff. In adjustment.
So Dr.
In an adjustment.
Yes.
That.
So Dr. Ahmed, I really want to give you a last opportunity to say any advice, any tips for anyone who you think might benefit from chiropractor or anything to prevent issues or back issues before we end this session.
I think everybody should come in for a checkup. You don't have to get adjusted. Come in for a checkup. We could check the posture. We could check your spine, your muscles, and we could advise you to what kind of exercise you're doing. And chiropractic works.
No, I'm a proof product that chiropractor works. And I honestly, like, I can't tell people enough how many people I've sent to Dr. Ahmed, and they all feel great afterwards and they continue, but they have to be patient and consistent. I remember Dr. Ahmed's first advice was that, Kauthar, you have to be consistent. So I really, really believe in the power of chiropractor and what it could do. And someone just say chiropractic stops dizziness. It happened to me. It stopped my dizziness and my spinning feeling. So Dr. Ahmed.
The neck, because if there's other reason for dizziness, right? So we can't.
Yeah.
Again, 10% of the people might not get better. 80% to 90% of the people will get better with chiropractic, and that's results.
I think people should not be scared. I think people should explore and learn and study, do self-learning. And as you mentioned, come for a consultation. You never know. You might not need a lot of things, or might need an adjustment because you twisted something and you didn't even know that it's not aligned or anything.
So many different techniques we could use instead of doing the cracking if people are scared of cracking. You know, with tiny kids, we use an activator. Even just give sometimes just a little massage, and that will take care of it. But the activator also is a gentle a technique that adjusts the spine. I use about 5 different techniques when I do the adjustment.
Now you make me feel like I wish I came for a session today. I feel like I need it.
Welcome, welcome.
So Dr. Ahmed, thank you so much for sharing your insights and making the time to talk to me today and sharing your knowledge with everyone. I hope people will learn something new and start, you know, unfortunately, there's a lot of people who claim to be helping people, but from a personal experience, I know what I can get from you and the experience you have and the education you gave me about spine health. So I encourage people to check Dr. Ahmed's account and go see him if you have any issues, or just take your kids, your family. You know, he's the best, honestly, in Abu Dhabi. So yeah, I encourage you guys to go. And Dr. Ahmed, I know that you have to head home soon and have nice dinner with the family. So thank you so much.
I appreciate it. You're a great sport.
Thank you. We'll see you soon. Take care. Bye-bye.